everybody, and welcome to yet another edition of the North Georgia Spotlight. I'm your host, Jack Ellis. Thank you so much for joining us again this week. We'd like to thank sponsors, Caduceus Medicine and J. Franklin Automotive. In the spotlight, I'm sure he's been all around the spotlight lately because he's a medical doctor. He's a CEO of Burton Medical Group, and he's a family physician here in Macon-Bibb County. Dr. Frederick Burton, welcome to our program.
Well, I'm glad you invited me. It's so much things out there we can discuss, and I'm glad I'm able to have this chance of being able to discuss one of the very important things going on in our community right now.
Yeah. Well, Doc, one thing that I want to talk to you about, I know of your practice. You've been in Macon, been practicing for quite some time. You have a large African-American population, probably a lot of them on Medicaid, Medicare. And what we notice is that the state population is about 35% African American, but yet the people who've been getting this disease, especially in Albany and Atlanta and some of the other hot spots, is running about 70% African American, double our proportion of the population. What caused that?
Well, it's kind of difficult to say. It could be multifactorial, but I think a lot of times you have to sort of distinguish between the number of people who have it as to the number of people who have it more serious. Now, in our population, we get a lot more serious infection that's more debilitating, more deadly. And I think a number of reasons why that probably happened is because of the medical condition of our community. High number of people with diabetes, high number of people that are overweight, high number of people that have high blood pressure, which, is all in that high risk category, okay? And I think that's the main reason why we get it so more prevalent as well as serious and end up in the hospital and end up dying. There's a higher mortality rate for us as compared to a larger number of the population at large.
Yeah. Now, you have a large practice here. Like as I said, you see a lot of people in this group over a certain age, overweight, obesity, with different pre-existing conditions. Have you personally had any of your patients to contract this disease?
Personally, luckily not. A lot of people that have like older family members, I've seen them have the disease, but they haven't like gotten it to that more serious extent. Some of the family members, patients of mine have passed away from this virus. But again, they were older population and also had multiple disease processes going on. So, yeah.
Now, most of your patients probably are insured. I don't know whether you turn people away as not insured, but most people don't have, a lot of poor people in this state, because we did not expand Medicaid, they don't have health insurance. Right. How would that, do you think that would have an impact if we expanded Medicaid? I'm not asking you to get into the politics of it because that's a political decision. But if you had to speak to the governor and all the other political leaders, would you impress upon this to get this Medicaid expanded?
Well, health care for all would be beneficial. It would help out a whole lot, especially when I see patients coming into the office saying they can't afford their medications. What are they going to do? Skip medication or skip a meal? Usually they skip the medication, and that makes it very difficult for me to try to get a lot of these conditions under control, which would not lead them to being in this position of being so much more disease prevalence going across our community. Now, if they did have insurance, that would take care of a lot of the detrimental effects to the society as a whole in regards to making sure that people are a lot healthier, are able to eat right, and able to make the right choices so that they can improve their life and have a healthier lifestyle. But unfortunately, since we don't have the insurance for a lot of our people, they have to decide. And usually it's going to be a meal or a shelter or something like that, as opposed to medication, which they don't really see the initial effects of it right away. But down the road, it can be deadly.
So we're talking about poverty. We talk people can't afford health insurance, have to make a decision between whether they're going to have a co-pay or whether they're going to have insurance, whether they're going to get the medicine or whether they're going to eat. So this thing has a double whammy on especially African Americans. A lot of them are poor, eating bad food because of food deserts. There's no fresh food available. So how do you advise your patients?
Well, what we try to do a lot of times, if we see they can't afford essential medications, we try to get them on like a certain plan with a pharmaceutical company. That's one thing we can try to do and get them on this so that they can get medication, first off. Two, I tell them some of the basic nutritional needs that they have so that they can go out and get it, as opposed to running to the fast food store and buying this and that, which like I said, leads to a lot of the obesity that we have. Some basic meal plans that we hand out, we try to give the people so it's simple for them to get and easy to cook, especially if you don't have time. The other thing is exercise. Got to have the time to exercise and get out and do some walking, getting that heart rate up and keeping that weight down. Those are all simple things that we can do that would help. And the other thing is, of course, smoking. You just got to stay away from that. So a large percent of the population that is sick or has problems have smoked, and that causes them to end up on a ventilator or in worse condition than the average population.
Let me reveal here that Dr. Burton was a city physician during my term as mayor. And we had a lot of sick people. Our medical bills were going up, our insurance bill. But one thing you pointed out to me, that most of our medical bills were from the very few people who were driving it up because of their conditions, because of diabetes, because of dialysis, or what have you. So this is an economic standpoint from a family standpoint, so it makes sense. The prevention of this, just how we take care of ourselves, could be a disease preventer.
Absolutely, absolutely. And, it starts when you're young. You get familiarized with certain diets and certain foods, and you get used to it and accustomed to it. It's kind of hard, I understand, for people to change later in life, but, if you can instill and try to get them to see what's going on, maybe you can get them to change to do something different, eat different, things like that.
Now, you look like a young man, but obviously you have, as I said, you were the city physician. That was 20 years ago that you were the city, and you had already been in practice. So the amount of time, have you ever seen, I know we haven't seen anything like this, but how is the medical community, your colleagues, you all discussing this? Are you just taken aback how this thing happened so quickly?
Well, I was just listening to the radio, and basically they were discussing that this thing was probably already here in January, not community acquired, not necessarily from China, but basically here already, because they are going back doing autopsies on some of the people that were sick back then and finding out that they had coronavirus and didn't even know it. So, like I said, it's a lot of discussion, a lot of debate, as opposed to where it came from, how it got here, and things like that. So it's just, it's a lot being discussed, even where I am, in regards to what's happening, what's going on. You hear a lot of hearsay about, they created this virus, but in truth, the virus has been around here for millions of years. And the thing is, if you look at how the virus operates, it sort of hijacks our immune system, our cells, and there's also been some theories in regards to that. And the viruses is also what helped create us, helped us to be there, because some of the cells and DNA that is in our viruses, in these viruses, are in us. So, and the other thing, if you look at it with the Zika and how that created genetic defects, that's another thing you need to look at in regards to how it's changing us and our body to a certain extent. So it's a lot of talk and discussion that we are trying to figure out and don't know everything about what these viruses do and how they operate in our body.
Well, your patients, like I said, you have probably a large patient caseload, so they're still getting sick, they still have need. How are you practicing medicine? How has this changed your practice, how are you seeing your people, how are you interacting with them, your patients?
And how's it going to change in the future? You know,
Yeah.
That's the other thing. Basically, what we're doing is what a lot of other doctors are doing is like telemedicine or televisits or phone visits, calling people, seeing how they're doing, seeing if they can check their blood pressure and vitals at home. I guess sort of having them take a little bit more responsibility in what they need to do as well to keep check on things. And we're just calling them up and seeing how they're doing and checking things like that. Now, if they have to come to the office for, you know, certain conditions, certain tests, certain surgeries or whatever, we'll have them wait outside, call the office so that we can get a room set up for them so they're not waiting in the waiting room anymore, where it's like, you know, where they used to, the way we used to do it, and have them go directly to the room. And that way it's a lot more controlled environment, a lot more sterile, and we can treat them one-on-one with masks, with gloves, with sanitizers and everything that we need, and do what we need to on a face-to-face visit. So it's changed that way for us now. It's reduced the number of people we talk to, we see, because you know, it's kind of hard sometimes to get in contact with people because they, you know, as you said earlier, I have an older population, and what happens is they aren't as well connected on the computer or internet. So that makes it a lot more difficult for me to try to communicate and get in contact with them or see them, period, see how they're doing. And that, you know, creates a barrier, unfortunately, with the older generation that I have to take care of. So how are we going to solve that in the future? It's hard to say. You know, it used to be a long time ago, they used to do house calls. The unfortunate thing is the cost is sort of prohibitive at going around trying to see people, unless we have somebody that's driving around all day seeing people, okay? So that makes it kind of difficult. But, you know, that's something to look at in the future as to what might happen.
Now, this disease, I'm hearing from all the experts, and I'm sure you know, being an expert yourself, they're saying that, you know, for the next year and a half here, until we find a vaccine, we're just going to be washing our hands and social distance and everything else.
Right.
But there's nothing else we can do to prevent this from getting to us other than these things. But so you're looking 18 months, is that your, that's when the earliest you think we'll get a, I see things are being fast-tracked. You think it'll take that long?
For a vaccination?
Yes.
Yes, because you have to do a lot of trials. You have to mass produce it. All the time when influenza was coming around, it took a while to get the right one. And pneumonia too, pneumococcus vaccination, and shingles vaccination. It took a little while. Initially, they had some trials where it wasn't as effective with the vaccination at that time, and so they had to revise it later on. So we'll see. You know, rushing it or trying to do it as quickly as possible, you know, there are going to be lags as to how well it takes care of everybody, because it's going to be on a limited population basis as to the response people have, and everybody has a different response. Now, in the future, as you get time and get do more trials with a larger number of people, you'll be able to see how well it takes hold and helps people with the vaccination.
Well, this disease is no respect for a person, even though it's affecting African Americans at a far greater number than other people, but as you said, because of pre-existing condition. So what would be your advice, we have about a minute left, to African Americans in general, the population in general, but African Americans in particular, when it comes to our health going forward?
Okay. Okay. Well, basically, what we need to do is take into account our own physical well-being. Okay. That means making sure we get out and try to keep our immune system healthy, staying away from things that will cause our bodies to be stressed out, from the types of foods that we eat, to the lack of exercise, to the smoking, to the, you know, alcohol, things like that, that would sort of tax our immune system. So basically, it's eating right, exercise, and try to stay away from those things that cause our immune systems to be taxed. The more exercise you get, the better you eat, proper foods is the best way to try to be able to fight off this infection if you get it. Now, the other way to prevent from getting it is basically just proper hygiene, okay? And keeping your distance, all right? That's the
And this is
only
real.
way.
This is real.
That's the only way you can try to prevent it, prevent yourself from getting it. Now, if you do get it, like I said, the best thing is making sure you take your medication, keeping your sugars under control, keeping your cholesterol under control, eating right, and not overindulging, okay, and making sure you exercise. Those are the main things that we can do to try to prevent it and be able to deal with it if we do get it.
In other diseases going forward, I'm sure the same applies. That
Exactly.
The healthier you are,
Right.
the better off you're going to be with any type of disease.
Right. And the unfortunate thing is you never know what else is around the corner because this is just one out of many.
Yeah. Well, thank you very much, Doctor. We appreciate you.
All right.
15 minutes went by real fast. We've been speaking with Dr. Frederick Burton, who is the CEO of the Burton Medical Group, and he's a former city official for the city physician for the city of Macon. He has a thriving practice here in Macon. We appreciate the advice that he's shared with us today. So take due and timely notice. Take care of yourself. Proper distance. Wash your hands. Exercise. Eat right. And wear a mask. Yeah, I have mine.
Hey, they were doing that in China for
I
a
have
long
a mask.
time.
I don't have a fancy one like you.
Oh,
But I
you're
have
good.
a mask.
Any mask to cover.
But we are 6 feet apart. This has been
right.
measured. I want you to know that. You're
you.
in no danger.
All
We
right.
ask that you all stay right where you are. We have something very important to discuss with you in the second half of this program. The census is coming up. And if we're going to get money for Medicaid expansion, for all the other medical equipment that we need, it comes based on the census to that particular community. So we're going to talk about the importance of answering the census and the connections with that, with health as well. We'll be right back. Hello, everybody, and welcome back. We are now joined by Ms. Sheknita Davis, who is the chairman of the Complete Count Urban Committee, the Urban Complete Count Committee dealing with the Census Bureau. She's not employed by the Census Bureau, but she's a civic leader, and she understands the importance of all of us answering the census, and she will share that with us here in the Spotlight. Welcome to our program.
Thank you for having me. It's a joy to be here and have the opportunity to talk about something that's so critically important to our community.
Yeah. Well, first of all, let me commend you, let me congratulate you for having the foresight and the wherewithal to start this Complete Count Committee, realizing that the urban dwellers are what? The most difficult to count?
Yes, and we are most often the ones that won't respond to the census. However, a lot of the programs and services that benefit our community use census data, and we have been severely underfunded for many, many years. It's important that we get this count right this time, especially coming out of a pandemic.
Yeah, you know, you're right. It's going to, because I think we're going to see Medicaid expanded because so many people have shown up without medical insurance and they're dying. So I think we're going to expand Medicaid, but what people have to realize, Medicaid expansion will be based on how many people?
How many people, yes.
And certain income levels, so you got to answer the form.
You got to answer the form, and it's real easy to complete. It's only 10 questions, probably about 10 minutes, and they've made it very easy and convenient for you to complete. But we got to understand, it's not about being in your business. It's not about reporting your information to another agency. It's a budgeting tool. And so if we don't have our numbers right, most of the time, African American communities and communities of color are the ones that suffer the most from not completing it.
So, you know, it's kind of a no-brainer. It's very simple to do.
Yes.
There are several ways, I understand. I used to work for the Census Bureau in another millennium, really. It was in 1990, the 1990 census. And of course, we didn't have all the online. We had to fill out the form and not going to do it. But now they have, how many ways to fill out this
Oh, wow.
form?
You have 3 ways. You can fill it out online by going to my 2020census.gov. It's real easy. It takes you through the questions. It prompts you through. You can also call in this time. This is different because now they can call in and take your information over the phone. That's 844-330-2020. Or you can actually mail your form back in. So you got 3 easy, convenient ways that you can actually fill it out. We were worried a little bit because there is a digital divide. Not every home has internet access, but you can access it on a smartphone. And if you're not able to access it on a smartphone, you can always call the number. So there are multiple ways to ensure that we get these accurate numbers that we truly need.
I was just reading, matter of fact, someone sent me an email this morning. The state of Georgia has a 47% return rate based on this document.
Yes.
But yet Bibb County, which is an urban area
Yes.
in the middle of this,
Yes, it is.
middle of Georgia, is the largest urban area, only had a 40%
Yes.
return rate. What are you all doing about that?
Yes, right now we have went up 1 percentage point. I checked before
We're
I came.
41 now?
We're at 41.
Yippee.
So what we've done, especially
We're still 6 points below the state average.
the state average, we are.
Did it go up as well? It's still 47, and
It's
we
still
went up
47.
one. Okay,
It's still 47. What we've done, especially, we had a plan prior to the pandemic of going out into the neighborhoods, having some census block parties and different things to try to educate individuals. But what we've done now is gone to a virtual platform. So we did a virtual community chat. So individuals could come on and understand. We launched a campaign, My Neighborhood Counts. That would mean we want Unionville, Fort Hill, Bellevue, every community to be counted. And that way individuals can ask questions while we're doing the live feed. So myself, Virgil Watkins, Dominique Johnson, Marshall Talley, along with 2 census representatives, did a live chat on Facebook Live. We're getting ready to do another one on April the 30th, but that gives us an opportunity to go into those homes and go into those neighborhoods that we normally probably couldn't get to during this pandemic. So we're trying to be creative in the ways that we get to them.
As I said earlier, you don't work for the Census Bureau, but this is mighty important work that you are doing. What drives you to do this kind of work? Obviously, we know the
Yes.
importance of it, but
Yes.
you as a young woman say, hey, we got some problems here, and if it's going to be solved, let me go out and solve it. Where
Yes,
did that
sir.
come from?
I grew up here in Macon and Bibb County. Unfortunately, my parents, my mother and my father, became addicted to crack cocaine during the drug pandemic that came through our communities. It was a crisis at that time, and me and my sisters and brothers suffered greatly because of that. And it was great community programs that helped me to turn my life around. I had 4 children by the time I was 20, but I also was a high school dropout. I ended up going back, getting my GED, completing a college degree here at Mercer University, and able to begin my career path working at DFACS and becoming a case manager supervisor. I was the last previous workforce development director before this, and that's when I realized that how much formula dollars matter that goes into our community. And our community don't understand how we hurt ourselves when we don't participate in things. And then we're not able to properly advocate and go and say, we need more money. I serve on the Head Start Policy Council. I just finished that call before I came here. I have 250 children on the waiting list to get into Head Start. Those funds are directly tied to census data. We can't afford to have our children behind when other communities and other races are able to have the resources in their neighborhood and we don't have them in ours that our children can advance. And so it's really important to me to see every community thrive, not just North Macon or the areas, but every community has the possibility to thrive. And some of us have an inequitable gap, and those data help us to make up that inequitable gap.
So you're giving back. The community gave you, the community was there
Yes.
for you, so you're giving back, and you
Yes.
still have children, I guess, raising.
Yeah, well, they're all adults now. They're all.
What? You
yeah.
look like a, well, I
Thank
shouldn't, you can't say that. You can't comment on
Yes,
but,
yes, they're all adults
well,
now.
congratulations.
Thank you.
For having persevered, if you will.
Yes, sir.
Having 4 children before age 20 as a single mom without an education, but you didn't let that stop you.
Yes, sir.
And that is a tremendous testament to your intestinal fortitude and your stick-to-itiveness and your
Thank you.
tenacity. And we need to put that in a bottle and sell it throughout this community, because I'm sure you will be a great inspiration and a role model for a lot of young women who find themselves
Of course.
in situations that they didn't probably plan on being.
Exactly,
Yeah.
just circumstances, yes.
But let's get back to the census. Now, this is the urban complete count committee.
Yes.
So we have Macon, we have Warner Robins, urban. So you all over the state or just the Middle Georgia urban community?
Macon-Bibb County.
Macon-Bibb County. You
is-
focus primarily the urban area of Macon and Bibb County.
Macon and Bibb.
The inner city, we used to call it.
Yes, yes, that's what we're focused on. We started back in July of last year. We went to a couple of seminars and things that was talking about the census dollars. So you're looking at estimated somewhere between $600 and $800 billion that get allocated based on census data. Georgia receives somewhere between $23 and $25 billion. And we want to make sure our community block grants, our Medicaid, our energy assistance, all of those services, as well as Section 8 waiting list, public housing, all of those use census data, along with businesses. Businesses use census data as well, looking to relocate to areas and different things. We need it to be right for our community. And we don't respond most of the time because I think that you may share my information with the police department, or you may share my information with my landlord, because my sister lost her house yesterday and her children are staying here with me because I can't let my sister be homeless. That information is 100% secure. It cannot be shared with any other agency and is punishable up to time in jail or $250,000 fine. It's only our communities that have those low response rates. Right now we have census tracts in North Macon that are up to a 60% response rate, where we have some neighborhoods in Unionville and different areas that have like a 22% response rate, that we are lagging way behind. And I think it's just because we don't know, or we think it's going to harm us in some way.
Well, you know, those are turbo statistics, but I'm looking beyond the census
Yes.
and looking at this, and that's another story for another program.
Yes.
But the absentee ballot.
Yes.
So if we're having such dismal response rate with the Census Bureau, we know
Yes.
how important it is. What will we have with the absentee ballot
Yes.
return rate? We'll probably have some of the same dismal response as well, which is not very good.
Exactly.
Yeah.
And what we've done is trying to, on our next virtual chat, we want to talk about both of those things together. We're going to talk about the census and we're going to talk about the absentee ballot, because some people, even the questions 8, 9, and 10, you don't know if you should complete that or not complete that on your absentee ballot. And so we want to make it as much information as simple as we can so that we can get the participation that we need.
Now, I understand you've extended the deadline. The
Yes.
census used to be April 1 was the census day, and now I understand it's been extended October, September? When?
Yes, the last date that I had was around August or September as a cutoff date of tracking the
But don't wait
information.
till, get the form in now.
Get the form in now.
Yeah.
And one of the things that also make it difficult is, I was on a call today, census reps can't go out.
Yeah.
Yeah,
Yeah,
so
because of this
because
disease.
of the pandemic.
But we can mail it in. You're watching it here
Yes.
on channel 112 and Cox Cable here in Macon, on
Yes.
YouTube. And we ask that you subscribe to YouTube and like us on YouTube and share this information on YouTube with all of your friends. The Middle Georgia Spotlight with Jack Ellis. And we want to thank you, Ms. Davis. Thank you,
you.
sir. And thank you for what you're doing. And good luck to you. Be safe.
You too.
And continue to spread the word, the importance of the census and these absentee ballots. We'd like to thank you all for joining us this week here on the Middle Georgia Spotlight. Until next week, I'm your host, Jack Ellis. Goodbye.